that movie Logan's Run? You guys remember that movie? I mean, the notion there was that after the age of 40, you are kind of sucking up natural resources. You're dispensable now as far as the government, the state is concerned. And the whole notion of Logan's Run was Logan, a 40-year-old, was going to run. He wasn't going to get caught and euthanized, meaning put to sleep. He was going to run and try and stay alive. And the notion in Logan's Run was at some point you're a drain on society. You're not as productive and as efficient anymore. So therefore, just on a resource allocation basis, we're going to take you out. And in Logan's Run, we're going to take you out at age 40. Well, this kind of surfaces again when we're talking about healthcare reform. And I guess there was this notion of the death panels, right? That there was going to be these panels that would look at end-of-life decisions and who gets care and who doesn't, and who is chronic and who's not, and who's terminal and who's not. And there would be a list that the death panel would go by, and then they would declare, you get treatment, you don't, you get treatment, you don't, based on a resource allocation type model. And of course, everybody screams foul, and everybody says that's ludicrous, and who would ever allow for death panels in the United States of America? And so it all gets squashed and all gets put away, and off we go. Well, recently, in connection with this H1N1 crisis, some different health care departments have been issuing some very interesting guidelines. And I pulled this one from Florida. In Florida, it basically says that if the state's hospitals get overrun or oversaturated because of this H1N1 crisis, here are some guidelines by which they should operate. They recommend that hospitals bar, and I'm quoting here, patients with incurable cancer, end-stage multiple sclerosis, and other conditions from being admitted to hospitals, end quote. Another recommendation, and I'm quoting again, is that doctors remove patients with poor prognosis from ventilators to treat those who have better chances of surviving, end quote. Now, those are guidelines. Now, tough decisions sometimes have to be made, but do you put them down in writing? Do you set guidelines out ahead of time? I mean, if I'm on a battlefield and I've got a bunch of soldiers that come in for triage, yes, I have to make some pretty difficult decisions as a medical practitioner on who's going to have a better chance of making it and who's not. But that's an individual, very difficult decision in the field. It's not based on some guidelines. It's not based on some resource allocation model. It's based on a heartfelt model that just says, look, all human life is precious, and I'm going to do the best I can to save everybody. But at one point, I've got to make decisions, and I've got to allocate precious resources in the field in the case of triage. But do we set up guidelines ahead of time? Do we set up protocols ahead of time? Do we set up panels ahead of time that says you're more valuable than this person and that disease is less treatable than that person? I think we're getting into a real dangerous place when we start applying utilitarian morality or utilitarian ethics to things like healthcare and human life. The greatest good for the greatest number. Wait a minute. We're in a situation where as resources can be allocated, that just by definition, based on a manual, I'm going to turn away that 20% of the people. I think life is much more precious than that. I think life is not subject to some preliminary guidelines that are followed by some more stringent codes and some panels that make final decisions. I think that life is much more than resource allocation. And so I think it's something to look at as we go forward, that although tough decisions have to be made on individual decisions, on individual situations, do we set these things up ahead of time? And who gets to set up these guidelines?